Good morning. Thank you all for taking the time to meet this morning. I know at the end of the semester it's tougher to engage, and your time, attention, and engagement is really important to me. Wow, what a year. What a amazing 13 months. It was March 16th, which was a Monday, when we heard that we were going to be shutting down due to COVID. And I think we, within a couple of days, we made that all happen. And we pivoted, and many of you did that quickly. All of you did that quickly, and many of you had not even conducted online instruction in the past. And a lot of people, support staff, everyone, as well as our instructional faculty and staff, pivoted and responded. And a year later, it's my sort of responsibility, I believe, to weave some of these harsh realities with some glimmers of hope. And this morning, I'm going to be just I'm not going to share. I don't have a PowerPoint slideshow to share or anything like that. I'd like to make this more of a discussion. I'd like to talk about our financial status, some aspects of our enrollment projections, what we know to date, our research, innovation, and scholarly activity, some new and ongoing initiatives within the college, and then opportunities for partnerships, outreach, and advancement. At 9:15 a.m., we're going to be joined by Provost Jen Bott and Associate Vice Provost Chris Cheatham. And Jen and Chris will talk about university level initiatives and some aspects of returning to work in the future and what that means, and also being at the mercy of what's going to be happening with COVID in the future, among other things. So many of you are well aware that we underwent a huge budget cut. What was originally about a 24.5% cut was restored, some of it restored back to, and then it ended up to be about a 21.9, 22% budget reduction. Academic affairs was, this was across the board at the university, and academic affairs was hit a little bit harder because we also had to account for scholarships, financial aid for our students, debt retirement of buildings, and other aspects of academic affairs that we had to keep whole. What this meant for the college was a $4 million about budget cut, about $4,056,000 in a budget cut. It was drastic, it's severe. Many of, I think we had 7 positions that were vacant at the time that we gave up. We had faculty retirements. 8 were voluntary with the incentive plan. 11 were planned. There were some faculty resignations. There were 3. And our administrative staff were cut at 22%, and that came out to about 7.8 FTEs. It was both with people and also with reduction in FTE. And then some operations, supplies, equipment, and travel reductions. We also had the opportunity to plan for rehiring in our college, and we have or are in the process of hiring back 8 faculty positions. So these budget cuts were not strategic. They haven't been historically or currently, and we've been going through cuts for a while now. The staff reduction in force was required at first to be 25%, and the college actually put a proposal in for a 22% cut in our staff, which ends up to be about consistent with our overall 22% cut that we had to endure. We made some administrative cuts to the associate dean and a chair. We have to remember we made a decision as a university not to lay off faculty, and our schools and departments were impacted differentially depending on who actually planned or took the incentivized retirement. Currently, or last year, we're hiring back 8 faculty, 2 in the Bronson School of Nursing, 2 in the School of Social Work, 2 in Speech, Language, and Hearing Sciences, 1 in the School of Interdisciplinary Health Programs, and 1 in Blindness and Low Vision Studies. So the campus restored our cuts, and there's some questions that I received about this. How is the campus restoring in any fashion some of the dollars lost? Well, the first one was back in September to go from a 24.5% across the board cut to this 21.9% cut. And that was about $500,000 to our college. The other one was with the pay cut that was in place for 7 months through the end of January and restored February 1st. And that was about $170,000 in restoration, although this was a temporary reduction and it doesn't affect our bottom line. And I don't know if people do realize that faculty and staff, there was a 2.25% pay cut. With administrators, it was 5%. And with the cabinet and senior leadership, it was 10%. So in our current year, this fiscal year 2021, we have had to cover some of the one-time and some of the impact of our cuts in various ways, much of which was out of our reserve. We started the year with about $900,000, but we had to cover planned retirements that are occurring this year. We had to cover the notice period for people who did lose their position, and we had to cover increased part-time faculty costs. But in the meantime, we've been able to leverage with some grants and contracts to cover faculty and staff. Of course, in your departments and schools, we have AHEC funding, which is the Area Health Education Center funding from the state, which helps us cost match $100,000 of people, which we cover half of which through the college and half through a grant to cover 2.5 FTE. We received funding from the state through for a resiliency center, and that helps fund my salary and some faculty and staff within our college. So we're trying to find creative ways of covering and meeting the current cuts that we've been under. We're creating new forms of revenue. I'll talk about that in a little while, as well as we should look at how we can use some of our endowments and gift accounts. And then I'm going to talk later about advancement. With our future moving forward, we're in a spot that we haven't been in a while. We will not have reserve moving forward into our SRM, which begins July 1st. And for those of you who don't know yet, that is Strategic Resource Management, which is really a responsibility-centered management approach, which really, bottom line, looks at revenues and expenses. With the SRM, we should be able to balance revenues with expense. And we have a proposed $20 million, $20,674,000 projected budget for next year. And looking at our previous years, building up to the next year coming up, we believe that we will be able to balance the revenues that we will be receiving through the campus with our expenses. We will be subventing other colleges at the level of $725,000. So that really says is that we are a solvent college. We're above the zero line by $725,000 currently in our first projection of the first year of the SRM. And the university looks to use a 3-year hold harmless period so that colleges can adjust in the revenues that they receive vis-a-vis the expenses that they have. And for those who are not meeting, are over expending from the revenues that they have, that hopefully they can come more toward balancing their budgets. We will be using some of our endowment accounts. For example, we need to look at some open endowed chairs, and again, some fundraising activities. So I believe that there is hope that we have a strong above the line college when it comes to the strategic resource management. Yet at the same time, we're held to a baseline budget that we will need to abide by. Some of our enrollment projections, and some people have asked questions about, well, the enrollments don't look as bad as we originally projected in a sort of a worst case scenario in our across the board budget cuts. But we still do not know the status of where we will be in fall, for example, of next year. It's looking good. There are more applications than the previous year. In our college, for example, our applications are up about 74%, or I'm sorry, we are responsible in our college for about 74% in the increase in applications at the university. We're strong, and a lot of that is due to some of our activities. And WMU is one of 4 institutions of higher education across Michigan with application numbers that are stable or up. And so the opportunity is there. Now we have to work at yield. Currently, our campus enrollment, if I have the latest correct, is 17% below last year. So again, our applications are up. There's intention to enroll, but deposits are yet to be made. And I think that's reflective of the uncertainty still that exists when we're talking about COVID and how some students might be going to some institutions closer to home in this time of uncertainty. I think I might have muted myself. Not quite sure how long ago that was. Our graduate enrollments are steady, strong, and actually there's some aspects of our graduate enrollment that are increasing, and I'll tell you about that in a second. So we've been doing a lot in terms of recruitment and outreach, including virtual immersion days, open houses. Our student ambassadors here are making virtual one-on-one meetings and calls. Our faculty have stepped up and have participated in a huge number of events and visit day sessions, virtual visits. Our student support staff, including those responsible for admissions, advising, student success, have stepped up and done amazing work. We've had enormous response on our social media, including an increase of 85% engagement on Facebook compared to last year. This is the same for the campus with our new look, our Think Smart initiative, and our advances of what we're doing in social media contacts, all of which helps in garnering interest in what we do. But again, yield is where the challenge will be. We have several academic programs that are bolstering our enrollments, including our first occupational therapy cohort of 48 students started this past fall. And we just received official approval yesterday from the Board of Trustees on the BS in OT or the occupational therapy assistant degree, and we're going to be moving that forward next year. We have our second DPT cohort of 30 students that started in fall, and both for the OTD and the DPT, our next cohorts are already in line for next year. The Interdisciplinary Health Sciences PhD is the second largest PhD program enrollment on campus, and that's something to be proud of, as well as the number of graduates per year is up there at our university. We're continuing to explore a Bachelor's of Science in Healthcare Administration in collaboration with business. So we're leveraging the College of Business. So we're leveraging our resources. I just approved yesterday a number of undergrad and grad certificate programs where I think we're looking a little bit differently at them and having them more in a manageable number of credits that people who have, for example, in graduate are studying in a different program, either a PhD or a master's, can get a certificate, for example, in holistic health or in mindfulness training or a number of other aspects that we for example, resiliency and trauma, that people can specialize in and earn a certificate along the way. There's increased interest nationally in public health, and I think there's a great opportunity for us to ramp up not only our wonderful Bachelor's of Science in Public Health, but the Master's in Public Health as well. And there's high job market increase and interest in health and human services careers. I think we are in a good spot to take advantage of the market and where and what students need and desire for their careers. In research, innovation, and scholarly activity, even under COVID conditions, we're strong. We're trending up positively. By the end of the third quarter of this year, for example, we have received $5.8 million in new awards. Last year, the total year, we were at 6.3 million. So we're trending upwards, and I think we can surpass last year. We ranked second only to the College of Engineering and Applied Sciences. And we also have 19 college researchers submitting 37 applications. And yet to find out about the results of those. So the future is looking really, really good. And not to mention, over the last year or two, publishing extensively journal articles, books, and book chapters. We were well represented at the spring convocation this past Friday. We had Bob Bensley being awarded for the largest total funding for a PI in our college, the largest college award to Drs. Ann Sheplow, Bridget Weller, and Jennifer Harrison. External funding expenditures over $500,000 was Bob Bensley, again, for the California WIC Eating Healthy Eating Program, and Dr. Carol Sundberg for providing daily living and social skills for developmentally disabled adults. A U.S. patent by Dr. Bensley again. He was awarded 3 times on the day. And also we featured Ann Sheplow for her presidential innovation professorship that she had a year ago. And so again, we were well represented in research. We have some really neat research core opportunities and initiatives, including seminars that are being provided through the Interdisciplinary Health Sciences PhD program on survey research methods, secondary data analysis, and data visualization. And we'll have more to come in the upcoming year. And we developed some scholarly support pods of senior faculty members focusing on scholarly goals for junior faculty. And those include Drs. Tiffany Lee, Maureen Mikas, Jennifer Harrison and Tyler are the serving senior mentors, and we will look to grow that program moving forward. We have a number of new and ongoing initiatives in our college. I'll go through those real briefly. Many of you know that we have established our Office of Diversity, Equity, Inclusion, and Dr. Betty Dennis is in that role. I want to applaud Dr. Dennis for not only agreeing to serve in that role, but then hitting the ground running, making our statement on racism and anti-racism actionable and real, working with the Committee on Diversity and Inclusion, and sort of integrating what we're doing with the office with the goals and aspirations and the activities of that committee, but in a much more intentional and formal manner. And please visit our website for updates on our Diversity, Equity, and Inclusion office. By the way, this office is also intersecting with campus initiatives, including the Racial Justice Advisory Committee and others, and the Offices of Diversity and Inclusion. In the future, we are temporarily being supported by Dr. Tyler on a contract as an extension of her work as Associate Dean in the past and our research initiatives. We look to open our Office of Research and Innovation over the next year, which would mean that we need to look for leadership in that role. More information to come on that. We're also looking at proposals by the Interprofessional Education Committee and the Global Engagement Committee to see how we can more solidly support those initiatives, much of which has been related to the service of faculty as their service roles at the university. Our strategic plan for our College of Health and Human Services ended as far as the time period goes in 2020. We have put a lot of thought into this, but as hopefully Dr. Bott will share a little bit later, the university is engaging in its next strategic plan. She has asked us to hold a little bit so that we're integrated and supportive as a college of the campus's larger strategic plan. As you know, interdisciplinarity is underway with the first 69 proposals reviewed by a committee headed by Dr. Bott. She will give you an update in her discussion at about 9:15. And again, we're headed toward the strategic resource management. We have to look at different ways of running our college, and I look forward in the future to share aspects of the SRM moving forward once we get clarity. And what we hope to do is to model it down to the department and program level. That's not ready to go yet. We will be working directly with business and finance and the academic affairs to roll that out when possible. Just wanted to go over a couple of other projects and partnerships. One, real briefly, if you haven't heard an update, I'd just like to update a little bit on the Resiliency Center. The reason I would like to is that there, because of the potential tremendous opportunities of engagement in this center, we have a steering committee of about 15 individuals representing all of the departments and schools in our college, as well as some from outside of our school. we're creating a long-term plan for the Resiliency Center through a logic model exercise being conducted with our steering committee by Dr. Lori Wingate, who's the director of the Evaluation Center. We have some of our first year goals and outcomes all settled in already, and we know we have a lot of work to do this year. We initially received $1.5 million, and we're hoping to get an additional $750,000 in 2 follow-up years for our Resiliency Center, with a very good opportunity for carrying forward some of the funds to really distribute over time, over the 3-year period, about $3 million. We're addressing needs of those experiencing trauma, toxic stress, chronic disability, neurodevelopmental disorders, and substance use disorders. We just gave out $130,000 from that appropriation from the state in competitive small grants to faculty, which in the form of a larger $100,000 award and 3 $10,000 awards for pilot and developmental work. It's pretty exciting. We hope to have the center sustained with federal, state, and as well as funding, as well as looking for opportunities with advancement to sustain that center. So I don't know if everyone knows of the update with the transformational campaign coming out of advancement. I'll just give you a little taste of it. We are in the quiet phase of this effort. And along with that, advancement has engaged a consultant, the name of which is Graham Pelton, to look at what are our transformational goals for our university that set us apart and different from other universities. That's underway. We should hear more about that after the summer and into the and heading into the more active, loud phase of the transformational campaign. We were asked as a college to come up, and this was just recently, with some areas that we would think would be amazing transformational ideas for the college. I'm going to share some of those with you, but then I am following up with asking you to think about what other aspects in your part of your role with the university and the college that we should be thinking of. And these are efforts that that some people have been involved with already, and some that would be larger ideas or initiatives in the future. And I look for your ideas conceptually at this point of what new and transformational ideas out of the college could be. For example, we have some student-oriented initiatives. For example, our Student Outreach, Engagement, and Success Center. We have a couple of donors who are entertaining this, and we hope to pursue that opportunity in the near future. We have some program development initiatives that are underway, including, I hope I'm not giving up too much, but just the thought of what would it be like to have a doctorate in nursing practice. The healthcare administration program could benefit from some funding, and we're carrying that and pushing that through with the College of Business as we speak, as well as a pharmaceutical sciences and discovery opportunity for the future of our college. There are some community-oriented initiatives. Faculty have been trying to jumpstart some of these, and we think they could be amazing opportunities for a donor to engage with, including Community Nursing Center, Resiliency Center for Families and Children, an Edison Neighborhood Center for Health, Education, and Social Services, and a Center of Excellence in Rural Health with Van Buren, as well as some of our existing centers that address community need in our local and regional areas. So I want to end and have some time for questions and answers by acknowledging our 2021 retirees. I don't know if you know, but last year in 1920, we lost 19 people to retirement. This year, we're losing 10 people to retirement, and I want a little bit of your attention to acknowledge these faculty and staff. Dr. Amos Aduraja, Jennifer Brown, I think it's Dr. Brown, Dr. Sue King-Berry, Jeannie DePoyen, Dr. Yvonne Ford, Dr. Barti Kadbama, Dr. Mary Lagerway, Dr. Helen Lee, Dr. Sue Nelson, and Sally Sakawi. Please join me in congratulating them on an amazing career with our college and our Western Michigan University. So with that, I'd like to just open the floor up for some questions. I know I received some already, and I could entertain those, or if there are some from people directly. I am not monitoring the chat, so Joel, if you would do that for me, and we could I could maybe provide some answers to your questions.
Sure. Yeah. There's one here in the chat, and they're still coming in on the anonymous form, which was in the email that we sent to you all earlier in the week. So if you want to submit them that way, that's fine too. The one from the chat, since we're in the hold harmless status for 3 years, when will we actually see the impact from the SRM implementation, and do you see those as coming positive or negative?
So I don't know if everybody knows, but the SRM, the initial modeling, and has been shared. I guess we could provide in the chat the link, and you can see where we are in the first year. Again, if you look at our college, we're projected to have about $20,700,000 available to us for our expenses. And I believe that at not just first look, intensive analysis, we should be able to run our college off of those funds as we sit right now with the 22% cut that we took. And to me, in my first looks, without knowing a number of factors, we're going to be able to meet our expenses, and at present, evenly. We are giving $725,000 to other units, other colleges on the campus. I may have these numbers wrong, but there's 3 colleges above the line that are in the positive. That's business, education, and us. And there's 4 colleges that are below the line. And those are, and by the way, that's in order. Business is the largest revenue producer, then education, and then us. And we are producing above the line by about $725,000. And oh, by the way, I think that's good. That means we're right-sized for now. We're not giving away a lot. We have intense programs that require laboratories and other hands-on, in-person, and equipment-related activities. So in that sense, I think we're good. The colleges below the line may have these in not the proper order, but the College of Arts and Sciences, the College of Engineering and Applied Sciences, College of Aviation, and the College of Fine Arts, in that order. I may have the order wrong. It's about $18 million that the colleges above the line are subventing to the colleges below the line. And we're in an okay place. The 3 years for hold harmless is to give those colleges an opportunity to be closer to the line, which in turn should then we should be able to keep some of the funds that we are above the line here. There's also other opportunities maybe that we could advance what we're doing, and we're already doing that with existing resources. For example, starting an OTD and an OTA is really kind of taking what we had as prep for OTA and also the masters in physical and occupational therapy and morphing those into a bachelor's and a doctorate. And with the same existing resources. So that's an example of how shifting has been allowing us to create a new program or new programs, but still have the same level of investment. I don't know if I fully answered the question, but that's where we sit with the SRM.
Ron, that was my question, and I guess part of what I'm wondering about is it almost sounds like our budget and how we are funded and things is really going to be pretty consistent for a 3-year pattern. And as I understand it, there's not a phase out thing so that colleges that are under that line may or may not be incentivized to move in that direction until they're absolutely forced to. So I'm just trying to figure out, will it actually look different between now and 3 years from now?
Good question, Mark. There's a set of deans that are working on what we're going to do as far as modeling and incentivizing and adjusting the model over time. So for example, it could be that we go from subvention at sort of 100% of what the colleges have left over to the other colleges, and then ramp that down, maybe 75% to 50%, and then start forcing the model for the other colleges to rethink and redesign some of their offerings and over time. But as you know, we can't flip that right away. So we're working, Mark, on what does that look, even as we look at the numbers in the first 3 years, we hope that we see some activity toward coming more to the line, but then possibly rolling out a framework for growth and keeping funds for opportunities for growth in those that can versus maybe those that cannot. So those discussions are underway. I do know that in advance of the meeting, there were some questions, and let me fill a little bit of the time on this idea that the university now has the resources to restore some of the cuts that were made. Remember, there were 2 forms of restoration already. From the worst case scenario of a 24.5% across the board was brought down to 21.9%, which had a $500,000 impact on our college, which was used to help us bring back some people, predominantly our faculty, where we had a lot of loss. The other one was restored through the pay cut restoration, starting February 1st. If there's any other restoration, it will be tied to enrollments, and it will be tied to the state appropriation. I have heard not so good things when it comes to proposals related to the state appropriation for funding our universities. I don't, we're at the mercy of the budget, and that happens right around October 1st, which is after we start our semester coming up. So as of now, there's no indication that we will have other funds to restore to the university as a whole or to academic affairs. Dr. Bob might be able to shed more light on that in a little bit. But I wanted to speak to that because that was a specific question. I'll fill the silence. There was another question about our leadership, our chairs and directors. We have Dr. Lagerwey is retiring, but we have someone from the within. We're looking for leadership opportunities for our departments and our schools internally, just like the campus, with several deans being appointed in this current year, as 3 deans actually. And within the colleges, the directors and chairs are, we're looking internally. Education, engineering, and a few arts and sciences, and a few others, as well as our College of Health and Human Services. So we're in the middle of that process with the Bronson School of Nursing. We're in the middle of that with the School of Social Work. And we will begin this process earlier this morning with the School of Information, School of Interdisciplinary Health Programs. So I can address that question that someone had prior to the meeting.
Sorry, Dean Sisler, I'm bouncing back and forth between a couple of windows, trying to find questions to fill the time here.
Sure.
In the last year, obviously we've moved to all online classes at some point, and remote work for faculty and staff. Is there any indication that the university or that the college is going to make any of that permanent, or move more toward that sort of delivery?
Well, one way I can start to address that is, yes, in spring we had to go fully remote, but almost immediately starting in summer, we had some of our programs who were actually involved with piloting how to come back, how to have students come back safely. And actually PA and PT, some of nursing, we were able to have hands-on instruction occur where needed in some of our labs, and we think we did that safely. There's no evidence to say that COVID cases, if there were some with our students or faculty, that it came through the interactions of when we had our labs and hands-on. Now, I'm not saying that it didn't happen, but there's no, it's hard to provide that evidence that that's what occurred. So we believe we did that very safely. We did it through distancing and masking, cleaning, and all of that. And we were one of the leading groups to start that process in summer. We continued it in fall and also in spring, and we're looking for those same things in summer. I don't think we'll ever be fully remote. I would hope not. Especially in our college, where those hands-on experiences are vital. That's not to say that we can't have aspects of our programs that are. If there are programs, though, that will be fully remote, we have to develop those from the ground up. And we have to go through a process of getting these programs approved in the future. So I don't think we'll be fully remote, especially when you look at our college. But any opportunities for full remote or online programs have to be developed intentionally to meet that purpose. And some programs are being conducted right now online. I get it. Probably not the full program, but most aspects of it. And I do see that Dr. Bott has joined us. Welcome, Provost Bott. I appreciate you being here. I don't know if Chris, Vice Provost Cheatham is on as of yet. Jen? So Jen,
I don't think so. But hi, everybody. Good morning. Welcome to Friday. Welcome to almost finals week, y'all. Hopefully you're as excited about that as I am. Except I have to grade all my finals. So I'm accepting helpers if anyone wants to help that out. I made a terrible mistake. I have, like, in the middle of my semester, I had a grading desert, which was great. I enjoyed that grading desert, except for now, because I had a whole bunch at the beginning and a whole bunch at the end and nothing in the middle. And so I've noted that for myself for future semesters when I teach this course. Hopefully none of you made the same strategic error.
So Jen, just to give you some context, we started our meeting at about 8:30. I gave a little bit of what's happening, sort of the harsh realities, but with some aspects of hope and what we're doing in the future. And I did that from the perspective of our college. We meet maybe once, twice a semester. Dr. Bott, for everyone else, and Dr. Cheatham have always volunteered to join us as when we have our college meeting. I think this is at least the second time, Jen, that I'm aware that you've come, and probably the third time, for sure the second. And we very much thank you. And Chris, thank you for your time. And the floor is yours.
Absolutely. Well, I'm delighted to follow harsh realities because that's usually my job. So thanks, Ron. I just, other than saying thank you for making it this far, both individually and certainly as professionals, it's been an incredibly difficult year. This is the platitude moment, but it's a platitudes that I feel quite intensely and empathetically with all of you. So I know when I use words like resilience and tenacity and determination, sometimes they can be accused of being overused, but they're the ones that I think describe how much it took to get here today, both individually and for your students, because in many cases you were their anchor to normalcy, even if you weren't feeling normal or the class wasn't how it was always taught. So I think it's finals week is always kind of bittersweet, but I think hopefully it's more sweet than bitter at this point as we move into what I really have to believe, so I can get out of bed every morning, but I have to believe is a more hopeful future. We're seeing case counts go down in Michigan. We're seeing vaccinations go up, and so I'm hopeful that we'll have some return to what normal will be. When I think about what we left in March of 19, I don't know that we'll go back to that in its entirety, and I don't know that we should go back. One of the things that struck me when I joined Western 3 years ago is the complete reliance on face-to-face education, and that can create difficulties for our students. And we've seen how they've endorsed online in the summer. Our online numbers, or our summer numbers, are up, and that's largely because our students want to go somewhere, right? They want to go home, they want to go on an internship, they want to study abroad, they want to work, and so online gives them that flexibility. And so before the pandemic, we were 95% face-to-face, and I know from speaking with our faculty members individually and collectively that we've learned some things that may help us teach better in the future, or teach and reach our students differently, maybe not better, but differently. And so those things came from the pandemic, and it's my hope that once we have a moment to reflect, we'll remember and find those positive things that made us more effective, or certainly I think all of us are more empathetic. But so I really am here, and Chris, we're here just to answer questions. I don't have a big speech. That was probably it. I don't know if speech feels like that's an overselling of those remarks, but Chris and I are just here to be at your disposal and your service for the next 40-ish minutes. Oh, okay. So I'm going to read the chat. So there's going to be an awkward squinting as I read. So doctoral assistants and graduate assistants are not influenced by the out-of-state employment because they are doing work in Michigan. And so one of the clarifying things that we sent out to our chairs and directors, our deans a couple weeks ago is, and this is why it doesn't apply to those folks that come to our campus and do work. It doesn't, in that case, the work is being done in Michigan. Same thing if you're a commuter, you live in Indiana and you drive over the border, or in Illinois is a little bit farther, or Ohio certainly a lot farther. But if the work is being performed in Michigan, that's what's the most important thing. So for out-of-state DAs that are coming, that's absolutely fine. We are, and we shared this, I think Chris shared this at Academic Forum on Wednesday before I was able to join. I'm paying for the comprehensive study to estimate how, or not to estimate, to precisely know how much it will cost to register in all states and provide unemployment insurance and workers' compensation, because it's not just the registration, it's also those pieces, and each state is different. And then we will make kind of, and we've taken the list of states that we currently have folks working outside of Michigan, working and living outside of Michigan, and we'll be looking at that. And so all current commitments, whether they're for DAs, TAs, GAs, term faculty, tenure track faculty, if there's an existing commitment, that will be honored. And so I think it's important. What about DAs that work remote? If it's Kieran, if it's an existing commitment, we will honor that, as we've said. And I would assume that individual or those individuals are captured in the Cognos report that will be guiding our strategy toward really understanding the costs, and then the responsibility for payment. Yes, for the academic year. If it is a commitment, verbal or in writing, because both of which are considered a contract, we will honor it. Hello, Elmer. That's Chris's dog. If you couldn't see the giant fur head that just got in the screen, that's Chris's, one of two of Chris's dogs. The other one isn't that tall yet. What else? Oh, sure. Thank you, Ron. Just keep plugging away over there in the chat. So we have been, thank you for all of you that are A, participating, or B, or maybe it's A, then B, in terms and submitted proposals to the interdisciplinarity initiative that we started last November. So I didn't have an expectation of how many proposals, because one of the things I struggle with is I don't like to be disappointed. And I don't like to, I'm superstitious that way, so I didn't have an expectation. But if I did, it would have been around 20 to 25. I would have thought was a really good showing. We had 69. And so this became too much of a good thing. And so the committee, and thank you again to those of the College of Health and Human Services, the members that are on that committee, your work on behalf of your colleagues is really appreciated. The group decided to all review the proposals, which was even though there are 2 pages long each, it was a lot of work. And so as a result, the committee is meeting for the final time next week on Thursday, and they will be at that point putting forward some recommendations around what can go straight to the curriculum committee that doesn't really need any endorsement. What is really they're encouraging folks to submit to round 2, and then those that might need some more conversation and discussion. The other thing we're doing is using kind of the breadth of topics to organize in the fall tables where folks can talk. Because that's part of this whole initiative, was getting big ideas out there so folks can find each other. That's one of the hardest things at a university. I've heard it way back when I used to chair the university's research council at my last university. I chaired that for 5 years, and everybody said, how can I find people who do my work if they're not in my college? And so this interdisciplinarity initiative was intended to raise big ideas to a campus conversation. And so we will be kind of ready to hit the ground, running, walking, jogging, however we want to frame it, in the fall. So we had hoped to have the second round proposal invitations out and back, but obviously with 69 proposals and then 2 that came in very late, so a total of 71, it was really difficult to get the work done and because of the volume. So we have, as I've said the whole time, we've been responsive to our campus as we kind of navigate this together. So next fall, we'll kick it back off after hopefully a really refreshing summer. Sue asks, can you please speak thoughts on requiring students to be vaccinated and faculty choice on teaching face-to-face? Sure, thank you. And so, there's been a lot of discussion about students being vaccinated. Currently in Michigan, only one institution is requiring any level of vaccination. That's only for students who are living in the residence halls or the dorms. No other schools are discussing it. We did see this morning, if you all, like I do, get up first thing before I even have my glasses on and read the Chronicle. The California state system and the California system are requiring it for all campus participants, faculty, staff, and students, and are doing so after it's fully approved, not for emergency use, but full approval from the FDA. And that's the first that we've seen. There is a list in the Chronicle of about 45 school systems, because I'd put Cal State and Cal in there as a system, that are requiring it, but the vast, vast majority, all but 2, are not public. They're either faith-based or private. And so, one of the things that I think is important is that we are encouraging folks to get vaccinated. We're encouraging our faculty and staff to get vaccinated, and we're encouraging our students. We had a vaccine clinic here on campus before, I think it was last week. And the position we're taking right now, these things evolve, as you know, the position we're taking right now is that we're encouraging vaccination, not requiring. One of the things that's also important to note is that we've had no evidence of transmission in the classroom this semester, even between a faculty and a student, even when we're in incredibly close quarters. And by that, I'm referring to the cockpits of airplanes, because the College of Aviation has been 100% on campus since last fall, even through the various shutdowns. And so we feel quite confident in masking. We feel quite confident in the increased ventilation systems. Now it seems that the cleaning of surfaces isn't as important. If you follow the new CDC guidelines, I guess we can all stop Lysoling our groceries and our boxes from Amazon that we might have had delivered in again and again over the course of the pandemic. And so, the classrooms will probably have some level of physical distancing. We put in for a normalish fall because we didn't know if it would be 6 feet, 3 feet, 1 feet, 12 feet, 15 feet. I mean, and so we will adjust accordingly as we get closer to fall. And Chris and I have said this many times, we let pedagogy, as we have this whole season, the whole beginning of the pandemic through now, be the choice on how instruction should be taught. And as a result, we have about 75% of classes either coming back to campus or being taught in a hybrid form. And so, people ask, what are we going to do if? We'll build scenarios. At this point, we are anticipating the ability, as all of the other 14 Michigan publics, to be able to return to campus with some level of normalcy. Normalcy is in fact not a word. Sometimes as a provost, I make up words, like interdisciplinarity is actually a made up word, but I did not mean to make that word up. And Rutgers required vaccination for students to register, and they are the only public, and currently they have 2 lawsuits against them. And I think that's the challenge, just one, it was filed this morning, also in the Chronicle. I encourage you, the Chronicle is just a wonderful source of news. And so I think that, again, we'll continue to see as things go forward, what the best guidance is. But one of the things we've been talking about doing, and this came out of the fall contingency group, is could we have, like we do on our phones, the badges, could we have a vaccine badge? We're looking into that. One of the challenges we have is that we can't ask, as you all know, I'm talking to professionals in the field, not me. I'm using my understanding, but we can't ask folks if they've been vaccinated. I know I've been in lots of meetings where like, have you gotten it? Have you gotten it? We're not really supposed to ask. And so I think it's important to recognize that we may want to know, but as you all know, that's protected medical information. If someone volunteers it, you can ask a follow-up. Where'd you get it? What kind did you get? But we've had some folks feeling very pressured to share that information, and it is their private medical. So we're going to try to work on, as you might have seen in the Chronicle, I'm sorry, Wright State University down there in Dayton is incenting kids with $10 to get vaccinated and share it back as a statement, a credit on their bill. That's kind of interesting to me, because it takes us out of the realm of the courts and requirement. And as Ron pointed in here, is because it's emergency use, hospitals aren't even requiring it. And to your question, Mark, we do have vaccinations that are required, but I believe it's just the basics. MMR, we do not require others like the flu vaccine, the meningitis vaccine. We don't require, well, this one would be a weird one for us to ask about perhaps, but we don't require the HPV vaccine. We look at the big ones like I think MMR. And actually what's interesting is the University of Michigan requires no vaccinations at all for them to attend. So we've got some variability in that here. And so it's a controversial topic. It's one that obviously we have great interest in, and we'll continue to watch. Oop, 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 oop. Oh, Wayne State is. Thank you, Amos. That's good to know. I know that Wright is. And so that's the kind of thing I'm excited to think about, is how can we incent students to share, and faculty and staff, because that's the thing. We've spent most of our time talking about students, but it's difficult to think about requiring things of only one of our campus community members. I think, that's the thing that's been surprising. And that's what is interesting to me about Cal State and Cal, is they didn't just say students, they said the whole community. And so when we think about that, I'd like to think, and Amos, that's a great suggestion. I'd like to think about the totality of campus. So how can we help everyone contribute to our understanding of the immunity of our campus? Okay, so let me just jump back up here. I apologize. And feel free at any time, Chris, to pop on in. Hey, why don't you want to talk about the SRM questions?
Yeah, that's what I was going to say. So do you want me to take that?
Yes.
Okay. Sorry, you're going to hear the dogs barking in a second. So, D asked, in a 3-year hold harmless period of the SRM, when will the above line colleges see the returns, at what proportion? So just to make one clarification, the hold harmless period is 1 year. And the remaining years are really a phase in. And so we don't really have a definitive answer to that yet. That's in planning, that after the hold harmless year, we know subventions will have to take place. And again, we've stopped calling those subvention, but they're called strategic investment allocations. And those will occur really between the colleges. So there's a group of deans along with me and the provost who have done some work and are continuing to do work on what really that phase-in period will look like after the hold harmless year. Because at one point we need to get to the point where we really invoke that incentive part of the budget model, and where colleges do see returns on their if they are ending the year in a positive situation. In a related SRM question, Dennis asked, will the SRM eliminate the extreme delay between the start of the fiscal year and when academic units actually know their budgets for the fiscal year? Yes and no. So where it will improve, where the new budget model will improve aspects, is our knowledge of tuition revenue. We'll have a little bit more historic value. We utilize an averaging system for that. What won't change most likely is the state appropriation part. As we know, our state is pretty slow on budgets. This week was a good example. The way our state works is the governor releases a draft budget, the House releases a draft budget, the Senate releases a draft budget, most of which are very different from each other. And then they go into the reconciliation period of trying to come up with one budget, which we often don't know until September, October, far beyond when we actually have to set tuition rates. So unless the state changes, that part won't really change. But we hope that the new budget model, we're working towards getting that idea of getting as close to, being able to do multi-year budgets as much as we can within the constraints of the environment that we exist in. I hope that answers your questions.
So Laura popped one in about administrative burden with hiring freeze. That is a question we also have, Laura. And so we are working toward that. Because you all feel it and my team does too, right? We're working toward that. I'm hopeful to have an answer in the next 2 weeks. And I'm hopeful, by the way, the answer is yes, we're good. That's what I'm hopeful for. That's the answer we would like. And I know that's the answer you would like. And thank you for putting up with that, all of you. And if you don't know what we're talking about, ask a colleague. But it's been heavy this year. And a lot of our other units, it's not a pressing matter because they don't have our cadence of hiring. In other places they might hire 1 or 2 people, but we've got a lot of activity, especially as we look into summer, especially as we look into fall. And so it's been a lot. It's a collective decision, but it's one that I feel like I have the greatest stake in. And so my advocacy should hopefully win the day, but let's just cross some fingers. Yay, right? We'll celebrate then. Thank you, Dee. Can you provide an update on the emerging role of WMX regional sites and how that factors into SRM? Actually, SRM in many cases removes the influence of WMUX in terms of revenue distribution and in terms of staffing. So one of the things, and and Chris, jump in, please, because I may misspeak. One of the things, so in the past, or current, I should say, WMUX has, we have revenue share for online programs, and then we also have, they have funding for both part-time term and tenure track lines. And so we have chosen, by and large, WMUX is a service unit, not a revenue unit. And I say by and large because University College will be at the Faculty Senate's recommendation overseeing, as WMUX did, our university studies degree. But by the faculty positions and the faculty support will be moving to the colleges, and the tuition dollars will be moving to the colleges as well. And so and I'm going to use this term, and I hope it's not offensive to my dear colleagues in WMUX, the middle person has been removed. Excuse me, it's not COVID, it's allergies. And so that is good news. One of the challenges we're still working on is how do we look at space in WMUX, because the space allocation, I'll use our Grand Rapids facilities, the space is multi-use, but it lives on the books of WMUX. And so I know that that's a consideration that we're still working on, and maybe Chris can give us an update. But in the SRM, WMUX no longer gets a portion of tuition revenue, and WMUX has transferred the funding, the full funding, to cover the responsibility of the faculty expense against that revenue. So their role has largely been removed. And they will, like my office, like your dean's office, like many offices, become by and large a service unit, not generating any of their own revenue. Chris, do you have anything to add there?
Yeah, I can add with respect to the space. So if a college has dedicated space in a regional location so that no one else uses, then the college will incur the full cost for that space. If it's a space that is shared, it's in a sense will be treated really how we are going to treat registrar controlled classrooms. We really look at the usage, what colleges are using the space at what percentage, and it's factored into the cost, the space costs in the new budget model, similar to those other spaces.
Jumping back to kind of COVID-related administrative burden, David asks, when will the travel restrictions be lifted? That's a really good question. I will tell you this right now, the CDC, you might have seen this last week, and the State Department moved 80% of international travel to level 4, which the university restricts prior to COVID and certainly does now. So I assume, David, you're asking about domestic travel, but so I'm not sure on the travel restriction. That's kind of part of my question, but I will say this is that right now internationally, we're not the only exceptions I have approved, because they come up through the provost office. The only exceptions I've approved are to level 0, 1, and potentially 2 countries, as dictated by the CDC on the international side. I haven't not approved anything domestically, but we haven't had people asking to go to conferences. We haven't had that kind of thing. We've had folks trying, for instance, I know of a couple that we approved last week were from our College of Engineering and Applied Sciences. The students were going to pick up materials for their various cars. They have the Sunseeker car, they have the Baja car that do various things. And so those are the kinds of things we have approved. And I honestly, I think we've been talking about what kind of guidelines we can suggest for approvals. But I think that's kind of in the same answer to the hiring freeze. Chris, there's a question about the SPADA program.
So that's a great question, and we actually had an SRM core team meeting yesterday where that came up. So if a student, so let me back up a little bit. So graduate tuition revenue is based on the program of study. So not the College of Instruction, but the program of study of the students, and it's based on headcount. So for example, if we had 2,000 total graduate students, that totally made up numbers here at the university, and CHHS had 1,000 of those students, you get 50% of the graduate tuition revenue. So what we've looked at, though, is, and it's a small number, there's actually only 100 graduate, if we look at fall 2020, there's only 100 students across the entire campus that actually have 2 graduate programs of study, I should say, or more than 1. But many of them are the certificate. So if it happens to be that the certificate is in the same college as the other degree program, the master's or doctoral, it really doesn't create an issue because the college is the same and that head count would be the same. But we have some instances, and I think it's especially in your college, where we actually have some College of Education Human Development students who do the certificates. And in that instance, we looked at, and we're going to get away from, and the rule doesn't say this, not primary program, but major. So that student would count towards the College of Education and the College of Health and Human Services. So this gets kind of in the weeds, but so the total number of, quote, head count would be more than our actual students, because it would reflect a student who had 2 majors would count twice. But that will allow the graduate tuition revenue to be divided up appropriately, so that it's not just the, quote, primary program, which might typically be the master's or the doctoral versus the certificate that receives the revenue. So we're aware of that, and we'll be making sure that no college is harmed by that, and we will adjust the revenue accordingly.
And I think that's also, I'm gonna tie it back to a question Ron asked. That's also how we'll deal with any interdisciplinary programs, like he's talking about, like in the interdisciplinary initiative, because some folks have said, isn't SRM and interdisciplinarity at the core, at its foundation, somewhat contradictory? And I would say yes, if we didn't have procedures, plans, and already kind of split those things in the back office, which is Chris's office, right next door, the other side of the wall. But we do that already, and we do that for certificates. And so I know that has been a concern, is if we put an interdisciplinary proposal forward, won't we be cutting our nose to spite our face, and actually no. And one of the things that I've said before, and I apologize if you've heard this, but half of something is better than all of nothing. And so that's how some of our certificates operate, and that's certainly how interdisciplinary proposals could be structured. And actually, Bob, maybe I just answered part of that question, but I'll have Chris jump in too.
Yeah, Bob, it won't be that college will only receive half the cost. And unless I'm misunderstanding, that's only in the instance where a student is doing a graduate certificate in addition to another graduate degree at the university. So if it's a certificate program, it's a standalone certificate program, and there's a student who's enrolled at the university just to do that certificate program, that student counts as a full head count for that college. So the revenue associated with that student's program will absolutely go to the college that houses that certificate. The split only occurs when a student is doing 2 degrees, which happen to be in different colleges across the university.
And if I could just for a second, oops, sorry, no, I'm gonna
wait. Yeah. Well, that's the case, Bob, that if the certificate is, like I said, if the certificate is a secondary, but the primary program is in the same college as the certificate, then the college gets that whole tuition. If it's not, then we have to, if the primary program is in a different college, well, then the certificate college shouldn't get all the tuition for that student because that student is also taking a program in a different college. So unless I'm not understanding that, yeah. So, but again, in graduate, the tuition isn't calculated on a course by course basis, and that's the way the rule was passed as far as graduate tuition. So it's the graduate tuition is pooled and then divided to the colleges based on that head count. Like I said, and we will base that head count on major versus, let's say, primary program, because if it was based on primary program, the secondary programs would not see anything. So yeah, that's the example I gave before, because that happens a lot, is that student would count really as a major in the College of Education and Human Development and as a major in Health and Human Services. So in some ways, the denominator of number of students would actually count a student multiple times if they had multiple majors. So it works out that both see the tuition revenue. But I will acknowledge there could be instances, and we talked about this yesterday, where, well, what about if one semester they happen to be working solely on the certificate and one semester solely on the master's? We do have to look at that. And Janet, these rules are all on the budget model website as they were passed. So if you go to wmich.edu/budget model, all the rules are in writing and have been for some time, that relate to the entire budget model, all aspects of it.
And I think Ron said what I was going to say, and we have an example of an agreement on the interdisciplinarity website between Cyber and CEAS and Hayworth. I would suggest entering into an agreement. Easily done, a couple pages, you sign it, Dean signs it, Dean's Dean sign it, Jen signs it, off we go. Because we know that there are complementary things that people tend to often do, right? And so I think that's what I would suggest is looking at your enrollment patterns and looking at where those patterns support having an MOU and making one. Really easy to do. It's literally, and you know what, while we're sitting here, I'll go jump in and just link it in the chat so everybody can see.
Yeah, and if I could add one thing on that, as dean's offices start to look at agreements like that, I think it's important to look at it really holistically versus just isolating on one program. Because I think what we're going to find is that we have a lot of students who take classes in other colleges, and we can start to get to the point where we have lots of those things. For example, there's a lot of students in colleges other than College of Education and Human Development who take evaluation and measurement and research courses in the College of Education. And so we need to look at it. We don't want to discourage, the budget model shouldn't have negative impacts. We don't want to discourage the benefit of students being able to take classes in other colleges. So we have to weigh that. And so I say, as we look at these agreements, let's look at it, because we might find that when one college thinks that they are, losing a lot of revenue this way, they might find their students are actually taking a lot of courses in other colleges as well who aren't seeing the revenue for that course. So that's just my public service announcement on that as we move forward in this model.
Mary has a question about prereqs, but I want to have a public service announcement too. So your college has both undergraduate and graduate, and we're talking about the split of revenue, but I'd like to go to that's at the end of the story, right? Like that's when somebody comes here and this is what I get, this is what you get. Let's shift our thinking for a moment to who's coming. And we're looking at an increasingly competitive landscape. And so this morning I have, as I get every Friday morning, some good news and some bad news. And these are kind of maybe the harsh realities that Ron was talking about. And working to get students here is so very critical. So right now, for instance, in terms of undergraduate, the College of Health and Human Services is 62% toward its goal of the goal for a freshman class, not the stretch goal, the regular goal. And we're seeing, and they're doing, thank you, Ron, you all are doing well. But many of our colleges are not above 60%. And so one of the things I know to be true is we can talk about splitting revenue on the back end, but we can't forget about the criticality of recruitment, both at the undergraduate and graduate level. We are still doing tours every day. We have almost 100% of folks coming to our tours. Our applications were up. Applications were third highest in the state, only behind Michigan and Michigan State. No other institution besides those two had an increase over 3 or 4%, and ours have been up 15%. But up doesn't mean anything unless we get them here, and that is the importance of yield. And so I know Ron and the team have been working, but if I could emphasize one thing, is that if we had more students, the revenue issues would not be as dramatic, right? And so how can we work together to encourage students to come to Western and stay at Western? Our numbers for fall were about 9% down, which is up. It's better. It's not up. Up is not down. I understand that, but it's getting better. But we're seeing pockets of retention issues, and they're really with our first and second year students that have not had the experience on campus that really encourages them to return. Our juniors and seniors are actually up, which is good news for our graduation rate. I mean, you can't graduate who you don't retain, but you got to keep them every year to persistence to graduation. So I know that we spend a lot of time dissecting the rules, but one of the things that I just can't emphasize enough is how can we work together and engage all of you to tell the story of CHHS, because our central admissions crew does a great job. The college admissions crew does a great job. But we need to do more. It is only increasingly competitive as the numbers of students decline in Michigan, and the college going rate is not seeing any increase. And I am concerned, given the last 18 months, that we will see a decrease. And that very much concerns me. Thank you, Nick. You're doing 8 building tours today, and that really matters. I can't tell you, I have the opportunity, I come in 3 or 4 days a week to walk past our families every day when I come in, because in the Welcome Center, and families are so excited. And we've started to do, as you have, I'm sure, the personal tours, and that's really been labor intensive, as you know, but really, really really, really important, in emphasizing what makes Western special, especially as we look to our #1 competitor, which continues to be Michigan State. So thank you for that. I just jumped on the soapbox for a minute, but as we were sitting here, the confirms came in for the week, so it just made it even more relevant. So, okay, so Mary, back to your question. I haven't forgotten it. What about prereqs before students are admitted into the program? And I assume this is for undergraduate, Mary, or graduate? Yeah.
Undergraduate tuition, the rule of the SRM is undergraduate tuition goes to the College of Instruction. So wherever that course is located, that's who gets the revenue for that course. So if they're taking a biology course, then that tuition revenue goes to biology.
Because right now they count as our students.
Well, they still do. That doesn't change. But the rule for, like I said, the rule for undergrad tuition is College of Instruction, not the head count, not the college of the primary program.
Okay.
And that's then the rationale why the group decided on that was because that college is incurring the cost to provide that instruction.
There's one more question, I think, on SRM, and then we can transition to July 6th and future look. What level of decision DS, what level of decision making will faculty have on the returns? The great thing about SRM is that our college deans and chairs and heads become really the decision makers for the college. And so, that's who will be making these choices. This really incents colleges to be entrepreneurial and to think about ways to increase resources. And I know that your dean has, since he came, really had an eye toward continuing education, professional development, however you want to frame it. And that's an incredibly important space, one that your fields, your areas of expertise are incredibly well positioned to tackle. And so that is one example of ways that this model incents that kind of thinking. But the deans are going to be responsible for managing both the returns and the losses. And our office serves as facilitators of that process. And then Shannon, thank you for your question. Can you speak to the plan for faculty and staff to return to campus on July 6th? Yes. So if you read the president's message, I think, gosh, was it 2 weeks ago? I don't know. Do you feel like there's no sense of time? I do. He had indicated in that we would start having kind of an evolution back to campus. So it isn't like a light switch like we turned off in March of last year where everybody pretty much went home. So what we're hoping for is that offices will open. It does not mean that every member of the office will be there on July 6th. It does mean that our campus offices and will start to open, and we'll start to see some more activity around providing services for our campus, whether they're students or each other. We're really seeing this as, I talked about this at Academic Forum on Wednesday, kind of a rotational strategy, and I'll give you an example of how that's been working for us. So Chris and I have been coming in since like November, I think, Chris, of last year, pretty regularly. We used to have a strategy where not either he or I were in the office every day of the week. But we realized, I don't know, 2 or 3 months ago that Thursdays, yesterday, are a great day for all of us to be here. So Haley, Megan, Chris, and I, and Datsa or Kathy are all in the office every Thursday. And so, and I think increasingly we'll start to all be in more. But Chris is in on Mondays. I'm usually in on, I was in on Mondays too. But so we have, long story short, we have a rotational strategy. We will choose to be working probably more together, all of us, and I shouldn't disclose everybody. I will disclose myself. We're working on our vaccinations up here, so we feel more comfortable, but that's the strategy we're taking. So we can be hopefully all here by the beginning of the semester, or for us, welcome week is really important too. Let's see. Jill, can you give an update on the timeline of 1WMU EAA project proposal addressing our front-facing student services of academic advising campus-wide. Yes, thank you for that. So over the last 2 years, we've been working on how we can better collaborate to provide a unified student services approach for our campus, knowing that our students often move between programs, between colleges, sometimes once, sometimes several times. And so at this point, most of the student success services have been brought together under one WMU. We were waiting on a little bit of information, but we look to continue to work to bring advising together over the next year, which was really kind of our focus, and hope to have some more information about those plans. And actually, Jill, you all probably know more about the day-to-day conversations than I do, but we are working to continue to bring those services together in support of our students. One of the best things about being on campus is that I get to hear the fight song every hour. I don't know if you can hear it too. It's really helped me learn the words because I used to have to read them at commencement. But now
Well, I want to thank you, Dr. Bott and Dr. Cheatham. Thank you for joining us. We're about out of time, and we are out of time. Thank you so much. That was very helpful, provided a lot of clarity and insight, and some hope, which we are looking for as well. So really appreciate your time. And if everyone else could hang on, well, thank you. Little acknowledgement for Drs. Bott and Cheatham. Thank you again for joining us.
it was so delightful to see you all, and I hope to see you in person soon, but best of luck wrapping up this semester and transitioning to summer that hopefully doesn't involve any more snow.
Thank you all.
Bye.
Bye.
Thank you. And I just want one last minute of your time to introduce Ms. Marianne Borba. Marianne is in the office right now, about 4 rooms down. Marianne, could you wave? I know you just did. Could you wave again? Marianne's our new business manager. She started March 1st. We've been intentionally giving her some time to ramp up on a lot of things. And as you probably imagine, she's been really busy addressing financial and personnel matters of our college with some support of others in our dean's office and you guys in the departments and schools. So welcome to our team, Marianne. We're very lucky to have you here with us. And with that, I think I appreciate everyone's time. Hopefully you got some clarity on some of the issues. Thank you for all that you do. Good luck on the end of the semester and have a wonderful summer. And I'm sure we'll be in contact in other ways soon. Bye, everyone.